My name is Ellsworth Wareham. I'm a cardiothoracic surgeon and practice that as my specialty all my professional life.
Meet Dr. Ellsworth Wareham, a pioneering cardiothoracic surgeon, longevity expert, and one of the world's longest-living heart doctors. Born in 1914, Dr. Wareham was among the first to perform open-heart surgery in the United States. A devoted advocate for heart health and disease prevention, he attributed his remarkable 104-year lifespan to a plant-based diet, daily exercise, stress management, and a few simple daily drinks that supported his heart and overall well-being. Dr. Wareham's lifestyle was centered on thriving well into old age with mental clarity, physical strength, and independence. He served as an inspiration to many, proving that longevity isn't just about genetics, but about making the right choices every day. His approach to long life was simple, yet powerful, and one of his greatest secrets was a few daily drinks that helped him maintain a strong heart and sharp mind for over a century. In this video, we'll reveal exactly what those drinks are, why they work, and how you can start incorporating them into your routine to support your own health and longevity. Water.
If you drink 6 glasses of water a day, you will have better cardiac health than if you drink less. It has been estimated that it will reduce coronary artery disease by as much as 50%, and you should keep your cholesterol under 150. It's almost unknown for a person to have a heart attack if his blood cholesterol is under 150.
The first drink Dr. Wareham emphasized for longevity is water. According to him, drinking enough water daily is one of the simplest yet most powerful habits for maintaining a healthy body and extending lifespan. He himself made it a habit to drink 3 glasses of water first thing in the morning, ensuring his body stayed hydrated and functioned optimally throughout the day. His belief in hydration was not just a personal preference, but was backed by strong scientific research that links proper water intake to improved health, disease prevention, and longevity. Water plays a fundamental role in the human body. It keeps our cells functioning, aids digestion, and regulates body temperature. Without enough hydration, essential bodily processes slow down, making us more prone to fatigue, cognitive decline, and chronic diseases. One of the key benefits of drinking adequate water is its impact on heart health. Lack of water in the body or dehydration thickens the blood, making it harder for the heart to pump, which increases the risk of cardiovascular diseases. Proper hydration, on the other hand, ensures smooth blood circulation, stabilizes blood pressure, and prevents conditions such as hypertension and strokes. Dr. Wareham's daily water intake routine contributed to his excellent heart health, enabling him to work as a heart surgeon well into his 90s without experiencing the cardiovascular issues that commonly affect aging individuals. Another major advantage of water consumption is its role in cognitive function. The brain is made up of about 75% water, and even slight dehydration can lead to issues like brain fog, memory problems, and poor concentration. Many elderly individuals experience cognitive decline as they age, and dehydration is often an overlooked factor in this decline. By ensuring that his body received enough hydration daily, Dr. Wareham maintained mental clarity and sharpness well into his later years, allowing him to stay independent and continue contributing to the medical field. A study published in 2023 in the journal eBiomedicine, was inspired by prior research from NIH scientists who examined the effects of long-term water restriction on mice. Their 2019 study found that depriving mice of sufficient hydration shortened their lifespan by about 6 months, which is roughly equivalent to 15 years in human life. This significant finding prompted researchers to explore whether optimal hydration levels could influence human health and aging. To investigate this, researchers analyzed data from an ongoing heart health study that began in the late 1980s. This large-scale study followed over 15,000 participants for an average of 25 years, making it one of the most comprehensive studies on hydration and longevity. Instead of merely tracking water intake, researchers used serum sodium levels in blood samples as a reliable measure of hydration. Serum sodium levels provide an accurate indication of how well hydrated an individual is, with normal levels ranging between 135 and 146 millimoles per liter. Higher serum sodium levels indicate chronic dehydration, which can lead to significant health issues. The study's findings were striking. Participants with higher serum sodium levels, indicating poor hydration, had a significantly increased risk of developing chronic diseases, including heart disease, kidney failure, and metabolic disorders. Moreover, those with consistently high sodium levels showed accelerated signs of aging at the cellular level. This suggests that dehydration not only increases the risk of life-threatening diseases, but also speeds up the natural aging process, reducing overall lifespan. In another study conducted in Hunan Province, China, researchers investigated how drinking water quality influenced longevity. This study, published in the Journal of Earth and Environmental Science, found that residents of Maiyang, a well-known longevity region, had access to water that was rich in essential trace minerals such as calcium, magnesium, and selenium. The research revealed that these minerals contributed to improved cardiovascular health, stronger immune function, and overall longevity. Centenarians in this region exhibited lower rates of chronic diseases compared to the national average, further reinforcing the idea that proper hydration with quality water is a key factor in extending life expectancy. For those looking to incorporate Dr. Wareham's longevity secret into their own lives, the recommendation is clear. Drink enough water daily to keep your body functioning at its best. Whether it's 3 glasses in the morning, like Dr. Wareham practiced, or a consistent intake throughout the day, ensuring proper hydration can lead to better health outcomes and a longer life. This simple habit, backed by both personal experience and scientific research, is one of the most effective ways to improve overall well-being and maximize lifespan. Almond milk.
I have always been inclined to be a vegetarian. My folks were farmers, and we had quite a bit of meat available, but it never appealed to me to eat animal products. I never did drink milk by the glass. I would use it on my cereal, and of course my mother, and then later on my wife, would use it in cooking. So I was naturally inclined toward a vegetable type of diet. But I was concerned about the adequacy of the nutrition. And when I found out that I could get by taking a little vitamin B12, why, of course, I then became entirely vegan. And I think that it has been a very fine form of nutrition. It's a little extreme to tell a person who is using flesh foods that you're going to take everything entirely away from them. But I have, when I was in practice in medicine, I would tell the patients that the vegetable-based diet was the healthy way to go. And as much as possible, we keep away from the animal products.
The second drink Dr. Wareham recommended for longevity is almond milk. As someone who followed a plant-based diet for decades, Dr. Wareham avoided dairy and instead chose almond milk as his go-to alternative.
I happen to be a vegetarian, and I think it has its advantages in longevity. I'm actually a vegan. A lot of people will say, well, where do you get your vitamin B12 from, and where do you get your protein from, and all that. But we know these days that that's no problem, really, to have a real balanced diet on a vegetarian diet.
Almond milk is free of cholesterol, low in calories, and rich in nutrients that promote heart health, weight management, and longevity. He often spoke about how animal fats, particularly from dairy, can contribute to high cholesterol and increase the risk of cardiovascular diseases. Instead, he opted for almond milk, which is naturally free of saturated fats and contains heart-healthy monounsaturated fats. Replacing dairy with plant-based alternatives like almond milk can reduce the risk of heart disease by lowering bad cholesterol while maintaining good cholesterol levels.
In our country, 1 out of every 2 men and 1 out of every 3 women dies of coronary disease, so that's pretty significant. If you want to live 10 to 15 years longer, you should live on a whole plant-based diet. Now, I emphasize whole plant-based because you can be on a plant-based diet and it can be refined so that it is not as healthy as it would be if it had all the nutrients in it. And it's valuable that you take some nuts with your diet. It has been shown that people that eat nuts regularly extend their life for 2 years.
Almond milk also contains vitamin E, a powerful antioxidant that helps fight oxidative stress, one of the key factors that accelerate aging and disease. For many people, dairy consumption comes with digestive issues, especially those who are lactose intolerant. Unlike cow's milk, almond milk is completely lactose-free, making it an easy-to-digest option that prevents bloating, gas, and discomfort. This is particularly beneficial for older adults, as digestive efficiency tends to decrease with age. Dr. Wareham, even in his later years, maintained a strong digestive system, thanks in part to his healthy dietary choices. Beyond digestive health, almond milk is also an excellent choice for weight management. Unlike full-fat dairy, which can be high in calories, almond milk provides a much lower-calorie alternative. A study published in the journal Food and Nutrition Sciences examined the effects of almond milk on body measurements and blood pressure. Researchers followed 30 participants who substituted 1 serving of dairy with almond milk daily for 4 weeks. By the end of the study, participants showed a significant reduction in body weight, BMI, and waist and hip circumference. This suggests that replacing dairy with almond milk can help with weight management without any negative effects on blood pressure. Another study, published in the Journal of Food Science and Technology, reviewed the nutritional differences between plant-based milk alternatives and traditional cow's milk. The researchers found that almond milk, despite being lower in protein, offers significant advantages in terms of heart health due to its absence of cholesterol and high content of vitamin E and unsaturated fats. Additionally, individuals who consume almond milk instead of dairy have lower risks of developing high cholesterol and obesity-related illnesses. Dr. Wareham believed that avoiding animal fats, choosing plant-based alternatives, and maintaining a balanced diet played a crucial role in his longevity.
I'm a cardiac surgeon, and one way to prolong your life, of course, if you need it, is to have some surgery. And I spent most of my life doing coronary artery bypass grafts. This is for people who have coronary disease and are in danger of having a heart attack, as you know. It's expensive and it's painful, and it's much better to prevent this condition if we can. There are many suggestions that people have about how you can do this. Some people say you should take vitamins, supplements, minerals, hormones, and so forth. But it's actually much simpler than that and much cheaper. The fact that I have lived a little longer than the average and have worked a little longer than the average does not qualify me to give you an explanation of how you can prolong your life. People have all sorts of theories about this, but there's been good scientific investigation done into what lifestyle will help you live longer. And whereas I am not an authority on it, there are those that are, and they spent a considerable period of time in studying this subject. And I'm going to refer you to 3 sources which I consider to be at the cutting edge of longevity. These 3 books are the China Study, the Blue Zone, and How to Prevent and Reverse Heart Disease. The Blue Zone was written by a young author who worked for National Geographic. He teamed up with a group of scientists and doctors and studied those places around the world where people lived the longest. And what they found out was that these places were in Okinawa, Sardinia, Costa Rica, and Loma Linda, California. Now, I don't know much about these other places, but I do know about Loma Linda because I lived there for 50 years. And the reason why his attention was drawn to Loma Linda was because a fellow by the name of Gary Fraser wrote an article on the longevity of Adventists in California. Now, there's quite a group of people who are Adventists live in Loma Linda, which is a university town, and they picked that out as the name for the study. But it's really a comparison of the Adventists in California to the regular population. And they found out that a Adventist male who's a vegetarian will live 9.5 years longer than a male in the regular population in California. Now, the Adventists have a certain lifestyle, as you know. They don't smoke, they don't use alcohol, caffeine beverages, and they believe in a whole plant-based diet. So apparently, this gives them quite a bit of advantage.
For those who want to follow in Dr. Wareham's footsteps, replacing dairy with almond milk can be a simple and powerful change. Almond milk can be enjoyed in various ways. It can be added to cereals, blended into smoothies, mixed into coffee or tea, or even used in cooking and baking as a dairy substitute. Whether consumed on its own or as part of a meal, Almond milk provides a creamy, nutritious alternative that supports heart health, digestion, and weight management, all key factors in living a long, healthy life. Soy milk. The next drink that Dr. Wareham emphasized for a long and healthy life is soy milk. He specifically chose it over regular dairy milk due to its heart-friendly properties and alignment with his plant-based lifestyle. According to Dr. Wareham, soy milk offers essential nutrients without the cholesterol and saturated fats found in cow's milk, making it a smarter choice for those looking to improve heart health, reduce the risk of disease, and promote longevity. Soy milk is made from soybeans, which are known for being rich in plant-based proteins and isoflavones, natural compounds that have powerful health benefits. Unlike dairy, which can contribute to higher cholesterol and clogged arteries, soy milk works differently in the body. It provides the protein needed for muscle and organ health while helping to lower bad cholesterol levels.
As you know, cholesterol is the chief problem you have to be concerned about as far as developing coronary occlusion and coronary disease is concerned. If your cholesterol is under 140, very, very seldom that anybody has a heart attack with a cholesterol of 140. Now, the factors that influence your cholesterol are things that we should know about. And one of the factors is the amount of saturated fat. And most animal fat is saturated, whereas the vegetable fat is unsaturated or monosaturated. So you have to avoid the animal fats. Now, there are those scientists, including Dr. Colin Campbell of Cornell University, that say that animal proteins will also affect your cholesterol, not just the fat. In other words, you pour off the cream off your milk and drink the skim milk. Even the casein of the milk will raise your cholesterol. And then people say also high intake of sugar will affect your cholesterol. So if you can keep your cholesterol under 140, your chances of developing coronary disease are very small.
Dr. Wareham himself believed in the benefits of soy milk as part of his vegan diet, which he followed for decades to maintain his overall well-being. By switching to soy milk, you can actively work toward reducing their risk of these life-threatening diseases while still enjoying a protein-rich diet.
And I want to direct your attention to this book written by Colin Campbell of Cornell University. And he made a study of 880 million Chinese, and he discovered that those that had the best health were on a plant-based diet, and that the ones that used animal products were the ones that had the Western diseases. But the most significant work that I know of that's been done on prolonging life has been done by Caldwell Esselstyn of the Cleveland Clinic and Dean Ornish of San Francisco. Now, these individuals are the only people that I know of that have actually shown by laboratory studies that they can arrest and reverse coronary disease. Both of these people used a plant-based diet, actually a low-fat vegan diet. Now, I want to show you this angiogram here. The one that's on the left, you can see the roughening in the coronary arteries, and then after they put the individual on a vegan diet for several months, you see that that's cleared up. Now, an outstanding example of a person who's followed this program is our former president, Bill Clinton. He had bypass grafts done in 2004, and he thought that he didn't want to go through that again, and so he got on a vegan diet, and he is an outstanding example of somebody that has done that.
A study published in the Journal of Nutrients reviewed the effects of soy foods, including soy milk, on human health. The study examined data from over 25 years of clinical and epidemiological research, confirming that soy consumption reduces the risk of chronic diseases like heart disease, osteoporosis, and even hormone-related cancers. Unlike previous animal studies that raised concerns, this human-based research validated the safety and effectiveness of soy in promoting long-term health. The study also reinforced that soy isoflavones function as selective estrogen receptor modulators, meaning they provide the benefits of estrogen without the risks, particularly for postmenopausal women. Another key finding from the study was that soy protein lowers bad cholesterol while maintaining good cholesterol levels, helping to protect the arteries and reduce inflammation in the body. To incorporate soy milk into your daily routine, it is as simple as using it as a replacement for dairy. It can be added to coffee, smoothies, cereal, or even used in cooking and baking. Choosing unsweetened soy milk is best for maximizing health benefits, as it avoids added sugars that can counteract its positive effects. Green tea.
People are very sensitive about what they eat. Now, you can talk to people about exercising, and you can talk to people about relaxation and good mental attitude and things like that, and they will accept that. But you talk to them about what they're eating, and people are very sensitive about that. If an individual is willing to listen, I will try to explain to them on a scientific basis of how I think it's better for them. I read a statement in the Wall Street Journal last year, I think it was in January of last year, that I thought was quite significant. And it was this, that all tastes are acquired except for breast milk. Now, this means, you see, that if you, as a parent, will start your child on a healthy nutrition, they'll like it. But an individual, let us say, who is old, even my age, can change their taste buds. Now, there are a lot of people that take too much salt, and their food they think is flat unless they have a lot of salt in it. But if you will diminish the amount of salt gradually, after a while they won't know the difference. And in a matter of 3 months or so, you can do a great deal to change your taste habits if you are willing to do it. If a person is willing to go through the change and give himself time, he will enjoy foods that are healthy for him.
The next drink Dr. Wareham recommended for longevity is green tea. According to him, green tea is packed with natural compounds that help protect the body from diseases that can shorten lifespan. He believed that regularly drinking green tea could significantly improve heart health and reduce the risk of life-threatening conditions like cancer and strokes. His views were backed by extensive research showing the powerful effects of green tea's antioxidants on the body. Green tea has long been known for its ability to fight disease. It contains catechins, which are natural antioxidants that help prevent cell damage. These compounds work to lower inflammation in the body, reduce harmful cholesterol levels, and improve blood flow. Dr. Wareham believed that beverages like green tea played a role in keeping his body strong and healthy even in old age. Another way green tea promotes longevity is by offering protection against cancer. The antioxidants in green tea help stop the growth of cancer cells and prevent damage to DNA. Regular consumption of green tea can lower the risk of certain cancers, including prostate, breast, and colorectal cancer. Green tea is also beneficial for brain health. As people age, they often experience memory problems or cognitive decline. However, green tea contains compounds that can help protect brain cells from damage, keeping the mind sharp and focused. A study published in the Journal of Clinical and Population Sciences examined the impact of green tea consumption on longevity, particularly among individuals with and without a history of stroke or myocardial infarction, heart attack. The study followed 46,213 participants aged 40 to 79 over an 18.5-year period, analyzing their tea consumption habits and health outcomes. The findings revealed that drinking green tea was linked to a lower risk of death, particularly among stroke and heart attack survivors. Participants who consumed 5 to 6 cups of green tea daily had a 48% lower risk of death, while those drinking 7 or more cups per day reduced their risk by 62% compared to non-drinkers. The study attributed these benefits to green tea's high antioxidant content, particularly catechins, which are known for their heart protective and anti-inflammatory properties. Incorporating green tea into daily life is simple. For the best results, it's recommended to drink 3 to 5 cups per day. Green tea can be enjoyed hot or cold, and can be brewed with fresh lemon for added flavor and extra antioxidants. Unlike sugary drinks or high-calorie beverages, green tea is a natural, low-calorie option that benefits overall health. Which of these drinks will you add to your lifestyle? Let us know in the comments, and don't forget to subscribe for more such insights on health, longevity, and well-being. See you in the next video.